Hello, my name is Quentin Hill. I'm a haematologist at Leeds, and I'd like to thank the ITP Sport Association for asking me to speak today on ITP and the COVID-19 vaccine. And clearly the COVID-19 vaccine was a big step forward in the management of the pandemic. And the first UK patient was given the COVID-19 vaccine on the 8th of December 2020. By February 2021, however, a report was published in the American Journal of Hematology in which 20 patients developed ITP within a few weeks of having their COVID-19 vaccine, and one of those patients unfortunately died of an intracranial hemorrhage. This was also published in the New York Times, and at the same time as this occurred as an emerging complication, so too was it observed that there was a complication, vaccine-induced thrombosis and thrombocytopenia, most commonly reported after the AstraZeneca vaccine. So the big question at that time was, is the COVID-19 vaccine safe? I think clearly the answer is yes, and I'll explain why. So if we look at vaccines programs more generally, it is recognized that ITP can occur after vaccines because a vaccine is an immune stimulus. And if you take the measles, mumps, rubella vaccine, which is perhaps the best described in which ITP can occur, then actually about 1 in 40,000 receiving the vaccine will develop an episode of ITP. So how does the COVID-19 vaccine compare? Well, actually, it's a less frequent complication. And the first high-quality study came from Scotland, observing that for first AstraZeneca COVID-19 vaccine, there was a small increased number of ITP cases, perhaps 1 per 100,000, but no increase in number of cases was observed after the first Pfizer vaccine. A larger study of the English population had similar findings. So for individuals of less than 65 years old, then thrombocytopenia attributed to the vaccine was observed in roughly similar numbers, 10 per million, but not more common after the first Pfizer vaccine, and not increased after both the second Pfizer or AstraZeneca vaccine. In the US, vaccine adverse event reporting systems documented thrombocytopenia post-vaccine to be even rarer than that for the mRNA vaccines, and certainly not more frequent than the expected background rate of ITP cases in that population. So we can conclude that new ITP cases can occur post-COVID-19 vaccine, but they are rare and mostly associated with the first AstraZeneca vaccine. The association should be considered if there is new or worsening low platelets within 30 days of vaccination, and alternative diagnoses should be considered, including VIT, and the hematologist making that assessment can do a number of investigations to consider alternate diagnoses. So how about those individuals who already have ITP? Is there an increased risk of relapse? Unfortunately, there are a good number of studies now published looking at a series of individuals with ITP and monitoring what happened to their blood count after they had received the vaccine. And here's a summary slide of that. And actually, these studies are remarkably consistent in this. And if you total up now, the definition of relapse differs between studies, but if you top them up anyway, then about 1 in 10 appeared to relapse. That said, I think a couple of the larger studies had slightly more permissive diagnoses for a relapse. And if you use the need for either new rescue treatment or an adjustment of treatment as defining a clinically significant ITP relapse, and actually that number falls to around 6.8 or 7% of those vaccinated will relapse their ITP. So there it is. And many of these studies were looking at the mRNA vaccines as opposed to AstraZeneca. So we can conclude that this potential for ITP relapse is not specific to one or other of the COVID-19 vaccines. Another sensible question at that point as well, is there anything that would predict which individuals were at greater risk of relapse? And a couple of studies looking at that did not find any clear associations. The two largest studies at the bottom did find some possible associations, that many of which tied up with those individuals with more severe disease. So those with platelets less than 30 at baseline, those who had had 5 or more treatments in the past or a previous splenectomy. But those studies were at pains to point out that identifying those at potentially greater risk was not in order to avoid the vaccine, but rather to have more careful monitoring following vaccination. So is risk of relapse predicted by vaccine type? And I think we've answered that, no. Another question that concerned patients at the time was, could ITP or other causes of low platelets be a risk factor for developing FIT, this thrombotic complication after vaccination? And the answer to that, again, was no. What about the clinical picture if the platelet count did fall after a COVID-19 vaccine? Are patients at, does the pattern of the disease differ from a relapse of ITP in other settings? And I think the answer to that, again, is no. So most patients who relapse in the setting of COVID-19 vaccine do respond perfectly well to standard first-line therapies, and there's no evidence at this point that a different approach to therapies in the setting of a post-vaccine relapse would be indicated. So is there value in monitoring the platelet count after vaccine? Well, our feeling is that that seems a reasonable thing to do with a 7% chance of a clinically significant drop in platelets. Our observation was that for most of the more marked platelet count drops, that was often evident within the first 2 to 5 days. So our advice is to check the platelet count at that point. And then again, if there are further symptoms or the platelet count is trending down. Now, for that smaller number of individuals in whom the platelet count does drop after COVID-19 vaccine, then the question might be, should they receive a further vaccination? That's a little harder to answer because of the dynamics of the COVID pandemic, both in terms of the severity of strains, the therapies on offer, and for individuals with ITP, the status of their condition and the severity of the complications they may have had. I think that there's very little in the published literature to comment on risk of relapse with re-challenge, but small numbers of patients in which some have relapsed again and others have not. I think generally, though, the risk-benefit balance, certainly early in the pandemic, would be to receive a vaccine re-challenge. So in the UK, the Health Security Agency is carrying out an assessment of the potential for post-vaccine complications for individuals with ITP. That data has been gathered over the last year or so, and includes the outcome of vaccine re-challenge. Now, in order to inform some guidance that was published on the British Society of Haematology website, that data was analysed after approximately 50 patients were looked at around November last year. And at that stage, there were 15 individuals rechallenged with COVID-19 vaccine, of whom 4 did relapse. And that data, again, will be analyzed and will help inform our advice going forward. So, yeah, that advice, both patient information and clinician guidance, can be downloaded from the British Society of Haematology website with the address there under the COVID-19 vaccine tab. But to summarize, ITP is not a contraindication to COVID-19 vaccination. If platelets are low at time of vaccine, then use a small gauge needle and press firmly without rubbing for at least 2 minutes after vaccination. The risk of relapse is around 7%, so it's reasonable to check the platelet counts 2 to 5 days after vaccination, and if the platelets are falling or there are new bleeding symptoms. And if there has been a post-vaccine relapse, then most patients do not relapse again if there's further vaccination, but discuss that scenario with your individual clinician. So thank you for your attention.